Hello, for everybody who's joining, we're going to get started in just a minute. All right, well, we give it just a moment for a few more people to join. Feel free to ask any questions in the Q&A or chat at any time during the webinar, and we will open up and do a Q&A session at the end. Okay, well, I think we waited long enough. So welcome to How to Interview When You Are Switching Specialties. If you made it to our last virtual event, we did a similar mock interview, and we are getting that recording up and going so that anyone can go watch it that missed. So we're going to cover top tips to confidently interview today. And let's see here. Sorry. I am the founder of Nurse Fern. I'm Emma. I'll be your guide along with Jacqueline, who is an RN talent advocate with Incredible Health. Incredible Health, in case you are new to this realm, helps nurses find permanent positions at hospitals. And they can also help you find positions where you are switching your specialty. So that's why we are going to focus today's interview on how to interview when you're switching specialties. I'm going to go ahead and give the floor to Jacqueline so she can introduce herself and give a little bit of background with her position and what you would go through with her in the interview process.
Thanks so much. Hi, I'm Jacqueline, and I am a registered nurse, just like most of you, and I am a talent advocate at Incredible Health. I have been a registered nurse for over 10 years, and I've done everything from perinatal, women's health, triage to fertility, and now working at Incredible Health. At Incredible Health, your talent advocates will help you nurses through the entire job process, from being curious to what jobs are out there to accepting your job offer. With us, you aren't trying to get the recruiter's attention. We have the recruiters asking you for interviews, which is just invaluable. Interview prep, such as webinars like this, are just part of one of the many pieces we do to make sure that you get the job that you dream of and deserve. Emma?
I just wanted to ask quickly too, where would they find you in the process?
Great question. So after you make your profile and we make sure that all of your choices, from what specialties you're interested in to location to shifts, we get all that information, then you come to me or one of my other team members. And I help you look at, immediately you're going to start getting interview requests from recruiters at various hospitals. I'll help you look at those and decide what you want to move forward with. I will do interview prep. I will be the go-between between you and the recruiters. I can answer any questions or concerns you have. I am your cheerleader, which is probably my favorite part. But really just get you through the whole process, any problems with the applications, till we move into finally actually talking to the hiring manager and then evaluating your job offer.
Awesome. Okay. So how this mock interview is going to work today. I will be the interviewer and Jacqueline will be the interviewee. Jacqueline is interviewing in our mock interview as a med-surg nurse who is transitioning or wanting to transition into an L&D role. In between each question that I ask, we'll take a pause or a timeout and just give some brief tips on how to answer that question, what went well, what didn't go well, just a quick convo so that you can take down some notes and apply it to your practice. At the end, we will open it up to a Q&A session. Depending on how much time we have, we'll just field questions back and forth. And this is a reminder, once again, that at any point in time, you can put a question that you have for us in the Q&A box of this webinar, and we will pull from there. All right, and I think you already got to one of my questions. I was going to ask before we got started what your nursing background was, but you got to that already, Jacqueline. So let's go ahead and get started. I am going to put on my hat as the interviewer. And as you've noticed, I'm in scrubs. This is something that typically happens when you are interviewing at a hospital. Management, the educator, other nurses, and support people that get pulled in for your interview are often wearing scrubs. They might have business casual on, but as the interviewee, we always encourage you to dress in business casual and not scrub attire for your interview. Okay, so let's get started. Hey, Jacqueline, welcome to the L&D department. We are really excited to have you here interviewing for this role. And we would like to get started by asking us if you could walk us through your resume.
First of all, thank you for having me and taking the time. I know you're busy and I am just so excited to be here. I've been a nurse for over 10 years now. I started, like many nurses do, in med-surg. As I grew more experienced and comfortable, I started to work in the float pool. There, I was recently sent to the postpartum unit, and I absolutely loved it. I've been requesting to go back. And it got me thinking. I've always wanted to do labor and delivery, always. And I'm finally ready to make that change.
Thanks, Jacqueline. Great. Time out. All right, I'm going to let Jacqueline hit some of the big points of the actual question. I wanted to focus really fast on the fact that she thanked the interview team. It's a great way to show gratitude and collect yourself quickly at the beginning of your interview. It also helps start that personal connection because really you want to make it as much of a conversation as possible. Go ahead.
Okay. I think what I did well there is I shared a little personal story. We don't want to share our life story, just a little personal story. And I also focused on the positive. I focused on what I want to do next, where I'm heading in my career. I didn't say what I want to get away from. For instance, med-surg is awful. I need to get out of there. Absolutely not.
Very good point. Keep it positive and geared towards what you're going for. All right, so we're going to do a time in. Thank you for your response, Jacqueline. That was very thoughtful. I would like to ask you now why you want to switch to this specialty.
I've just always thought, since I had my own children, that being that nurse that is there during one of the most vulnerable and scary and exciting times in a woman's life, I just can't imagine how rewarding that would be. It's something I've always thought about. And I firmly believe that nothing good happens from staying in your comfort zone. If you really want positive changes in your life, you have to get out of your comfort zone and go for it. And I'm ready to do that now.
Perfect. Time out. I really like how Jacqueline brought in the emotional support side of what she wants to do going forward. I just thought it was a great response. Do you have something else you want to add?
No, not at this point.
Okay. Yeah. I think the being vulnerable and talking about getting out of your comfort zone was a really good place to be here. All right. Time in. Can you tell me about a time, because L&D, we deal a lot with family members and the entire family unit. Can you tell me about a time that you've dealt with a difficult family situation with a patient?
Yes. I remember I had this one patient and her family was very, very, very involved in her care. They all had opinions, and when I would try to talk to the patient, they would all speak up. And I didn't feel that the patient was telling me how she felt or what she wanted. So I actually asked the family to leave so that I could conduct my physical exam in privacy. And I did that. But while I did that, I asked the nurse or the patient what she wanted, what her opinions were, and gave her the time to advocate for herself so that I could advocate for her. Before the family came back in, we actually made a little code word that if she started to feel overwhelmed and wanted her privacy, I would say, if she said the code word, you know what, she really, really needs to rest. Maybe we could all go get something to eat while she gets some rest. And she did use that code word by the end of the day.
Perfect. Okay, time out. What I really liked about your answer here was that you followed what we typically call a STAR format, where you give a situation, talk about what you did and what the result was. So you shared a story that was memorable, and you acknowledged that, yes, difficult situations do happen, and talked about it. But then you added in this extra thing that I really liked, where you really talked about patient advocacy and being there for the patient and making sure that they had what they needed, which is really important in all parts of nursing, but especially L&D during labor.
Yeah. I will say, sometimes I used to do interviews at a hospital, and sometimes nurses would come in and they would say, I've never had a difficult situation. And we all know this to be not true. Having a difficult situation does not reflect poorly on you at all. It happens to the very best of nurses. Situations just arise. So I always say this is one of the most popular questions that you can get in interviews. So before you interview, think about it. Think about a time that something happened. And again, we don't want to focus on the negative. We want to showcase how you took some lemons and made lemonade. Happy story.
I like that. Keep a list of stories ready to go so that you can collect yourself quickly and get your response out there when the question comes up, because it will.
Yeah.
All right, time in. Jacqueline, thank you so much for that thoughtful response. I really enjoy how you I liked how you handled that situation with that patient and their family. I can see that being something that's really important here as well. As we move towards closing out this interview, I did want to ask, where do you see yourself in the next 5 years?
5 years from now, I would love to be an experienced L&D nurse who feels totally confident that I can handle any situation thrown at me. I want to be that nurse that the younger nurses or nurses going through a particularly rough situation, I want them to come to me for guidance. So hopefully in 5 years, I will be the charge nurse on the L&D floor and have 5 years worth of patients that I have helped to look back on.
Thank you. Time out. What worked really well is that Jacqueline focused on where she would be 5 years in the role she's interviewing for and advancing within that position and growing. Go ahead. Anything you want to add, Jacqueline?
No, just reiterate that sometimes your ultimate goal might be to become a midwife and leave that hospital. You can keep that to yourself right then. You always want to project that no one wants to hire someone for a short time. We're here looking for permanent nursing roles. So just talk about yourself in that department. Who knows, maybe you'd even be the nurse manager by then, but still within the department.
That's so true. People always bring up like, but am I lying? It's like, you're being selective about your information to meet the interview. All right, so we're going to do a little bit of time in here, and this concludes the main portion of the interview, Jacqueline. And I wanted to ask in this portion if you had any questions for us. So I'm going to do a timeout here because this is a big question that comes up, and a lot of nurses wonder how to ask questions. Should they ask questions? What type of questions should they ask? And I would encourage you as a nurse to, number one, make sure you ask about the follow-up process after the interview. Like, what are the next steps? when can you expect to hear from somebody? Who would that be? So that you know when you should follow up. And then also it is an opportunity to really show your curiosity and your interest in the department when you come with questions about the position. Let's see here. Do you have any tips for that one, Jacqueline?
Two things. I agree with everything that you said. One thing I like to ask is about career and development opportunities to show that you want to be an engaged employee there and you want to grow with this hospital system. So I always like to ask that question. And then as far as following up goes, I cannot reiterate enough. Please send a thank you email. You can ask the recruiter who set you up on this interview, the personal assistant of the hiring manager who set you up, ask them for the email address. A lot of public hospitals, the email addresses are available online. You could even call the hospital and ask, but find that email address and write a thank you note that day. If you really, really, really want to go the extra step, my super duper weapon, secret weapon that I've been using myself for over 10 years. I actually take the time and I write a very short and sweet handwritten note, right? Old school. I then take a large manila envelope, put my little thank you note in there. And I also include my cover letter, my letters of reference, my resume, and I hand address that envelope to the nurse manager and physically mail it. Because think about it. When you're at home and you're getting all your bills and normal mail, and you get a large manila envelope that is personally addressed to you in handwriting, you're going to open that. That sparks your curiosity. And I promise you, when the hiring manager, you're the only person that's going to do this. When the hiring manager gets this from you, it's going to make such an impression, and it's going to show how innovative you are and how passionate you are. And I can't tell you how many hiring managers have said to me, I couldn't believe it when I got your thank you note. So
I was so surprised when you suggested this in our interview because I've done thank you notes, but I've always put them in the little thank you note things. I've never tried that tactic of putting it in a manila envelope, and it truly does. That gets your attention and you open that.
yeah, absolutely.
Let's see here, but I'm going to give a gentle reminder to put any of your questions in the Q&A because we're going to get started in just a moment with those. So you have a moment to pop into that box and ask your question. Nobody else can see them, only us. So we will ask them and keep you secret. I did just want to highlight that one of the big things with switching specialties and interviewing is to make sure that you are taking your current experience and always translating it towards where you want to go. And this works for any transition that you're making in nursing between specialties, between departments, hospitals. Look for those connections between where you are and where you want to be, and really connect those dots for the people on your interview team. Okay, so let's go ahead and get started with the Q&A here. I am going to ask Jacqueline the first question, and it actually comes from our Q&A box. And you did touch on this, so I just want to make sure that we round it out. But is it ever okay to have note cards with reminders of what you wanted to talk about? My mind goes blank during interviews.
I say yes. I personally always, and this is something else you should always do during a live interview, have a little, folder with a notepad in it, something like that. It's always okay to take notes. And when I was interviewing people, I always took that as a sign as, oh, they're paying attention and they care about what I'm saying. And you could, of course, have a few, things written down before you get there, but that's also a place to have extra covers of your resumes, letters of reference to pass around, because sometimes your interview is with one person and there end up being 3 or 4 people there, which is great. So just bring extras and be ready to share, but absolutely it's okay to have a little notepad with some reminders. And I encourage you to take notes to show that you are engaged and you do care.
Fully agree. Everybody's human. So having little things, it's not going to come off poorly. Let's see here. So I have a question that came from Instagram. And it is, I really want to do this role, but I don't have experience in this. Do I have a chance? And I'm going to say yes, absolutely. In nursing, we move around from position to position. It's one of the greatest things about our profession that we can start in med surg and go to ICU and then leave the hospital for a little bit, come back. It's all about translating your experience into where you want to go and shooting your shot, because somebody might not want you if you don't have that exact experience, but the next manager might be fully willing to train you. Okay, let me find another one. Okay, Jacqueline, when do you ask about scheduling policies, holidays, PTO, etc.? Is this appropriate in the interview?
For the hiring manager interview, I really like to keep it to about the role itself, the unit itself. You know, maybe if it's a magnet hospital, you know, bringing up that sort of thing. When it comes to, you know, the shifts that they're looking for, obviously that's something you want to be, you know, aware of. But when it comes to things like benefits, compensation, I don't ever bring that up with hiring managers. That's between you and HR. And that, you know, this interview should really focus on, is this a good fit for the both of us, and not what you would be gaining from it on the back end. So yes, it's of course, for, you know, okay to ask about shifts and things like that, but I would keep the more, you know, delicate things for the recruiter and HR.
Perfect. I'm going to combine two questions here because they kind of go along together. But the first one was, what are the best questions to ask the interviewer? So at the end, when they ask if you have questions. And then the second one was, as a seasoned nurse in med-surg, how does training differ when going to another specialty? Should it be different than a brand new nurse? And I'm putting these two together because, like I said earlier, my favorite question that you should always ask is, what do the next steps look like? So you know what to expect after your interview. And that includes when HR is going to contact you, when you get an offer, so you can start asking those questions about PTO and other policies. But then also during your interview, when they ask you if you have questions, a perfect curiosity question is to ask what training looks like and how it differs if you know that they have different training programs for different levels of experienced nurses. That was a really good one to show your interest and engagement. Okay, I've got another one from Instagram for you, Jacqueline, and it's
All right.
Oh, what's up?
Is it all right?
Okay, cool. Let's go. How long do I need to be at a job before I can start applying?
Okay, so this is something actually we discussed before, and I immediately said my blanket answer was 6 months. And Emma agreed with me, but then said, you know, it's a lot more nuanced than that. Are you someone who hasn't had a job longer than 6 months before? You know, you don't want to be people to be concerned that you're, you know, kind of a serial job jumper. You know, there's lots of different things that could affect whether or not it's, you know, what length of time could be appropriate. Do you have anything to add?
I think, yes, it's much more nuanced, and sometimes how your job history is perceived is viewed through the looking glass of what that recruiter has experienced before and what they have preconceived notions about. So sometimes it might not have anything to do with you, but it's some opinion that they formed based on a previous experience. And there's not really much you can do to change about that, but you can explain why you're doing what you're doing.
One thing I really like to do with my nurses when I'm giving them interview prep is they'll ask me questions. will they be okay that I haven't worked in 2 years? I had a baby, da, da, da. And my answer is, I don't know them. The hospital's going to have their thoughts. The recruiter's going to have their thoughts. All we can control is how we frame it.
Yeah.
And so I say, always, always acknowledge and spin, don't lie, but spin into a positive.
I completely agree. And everybody's human, and the right interviewer is going to pick up on that and fully understand that sometimes short tenure jobs happen, family breaks happen. And I feel like in nursing, it's a little bit more accepted too, that this is going to happen as a female dominated profession.
Yeah.
Okay, I just keep getting questions that I want to ask you, so I'm going to ask you another one. And I think it works perfectly because of the model with Incredible Health. But how do you answer, and when is it actually going to, I'm adding to this, when is it come up and appropriate to talk about compensation?
So usually compensation, and this could be different, but as far as Incredible Health goes, when you get an interview request, you will be speaking with a recruiter. And that recruiter, they will have a window. They'll have a guesstimate, because your actual compensation always comes down to HR. They'll have their own little formulas of how many years you've worked, what degree you have, yada, yada. So the recruiters can certainly give you a range, a very nice, range, so that you can know if this is something you want to work with or not. But you should always keep in mind that when you're going for a permanent nursing role, you're not just going for that hourly paycheck. There are lots of benefits that you can get through hospitals, from healthcare to help with education costs, commuter programs, relocation. There's so many things that could also factor in, not just that one hourly wage number.
I've also found that this isn't something that's going to come up within the interview that you're having with the hiring team. They actually have almost no knowledge for what the comp ratios are. And it is something that's going to happen on the outside with the recruiter.
Mm-hmm. And after the hiring manager, you might go back to the recruiter. You might be sent to HR when you're discussing the job offer. And that's when exact numbers will come in. And we at Incredible Health are very happy to help you go through all of that. So you can kind of, look through all the mess and see, what's most important to me, and are they meeting those needs?
That actually segues nicely into the next question that I'm going to piggyback onto, because it talks about the required question on ATS applications when you're going yourself to companies, and it has that "what are your salary expectations" box. And a quick note on applications that are online and with required boxes: there is some advice out there to type in XXX or 111 or negotiable, but this can be considered a knockout question and can be set to "can your application" right there if you didn't enter a true number. So I would highly advise, if this is on the front end of an application, one, it's not set in stone. So until you find out what their range is, it's still a discussion and a process. You're just giving them some numbers. But do some market research with what's available to you and give a broad range of, you can even give a range of $30,000, what would be appropriate for that industry and your location, so that you are hopefully within what they're looking for and what you're comfortable with as well. But definitely on those, if you want to move forward, you're probably going to have to put a number in there. If you work with Incredible Health, they're going to help you with this, and they're going to bypass that whole system.
Yeah.
Okay. Now, one of the other ones that I'm going to throw your way, let's see, because Incredible Health has been working a lot with pediatric hospitals, and possibly with that transition from adult to pediatrics. So something that's been coming up in the discussion is, "I've never worked with children. Is it difficult to switch?"
I personally don't think so. I think that before working with children, you should think about, is that something I want to do? Do you like talking to children, working with children. If the answer is yes, I also want you to keep in mind that your patient is no longer the only person who has a say. They may have a guardian, a parent with them that is making healthcare decisions for them as well. And so it's not just your one patient anymore. You really are treating the family when you're a pediatric nurse. But as far as how different it is, yes, there's some different, vital signs. There's some, obviously dosing is different. There's some different considerations, but I found going from adults to newborns personally, not a problem. Actually, very easy. They're really just little people.
I like that. One more question that we're going to hit before we close out today. And this goes back to, I'm sorry, I'm going to give you another one. You're just so good. And it's because you shared your secret weapon about the thank you notes. But what do you actually include in your thank you letter when you send one?
I always sandwich my thank yous. So it's hello, I just want to thank you for your time and your consideration. And then I will say something usually interesting that I learned in the interview, such as, they have had a lot of Daisy Award winners in this unit. The hospital's about to be magnet, touch on something that you learned in the interview to show that you're engaged and you're paying attention to what they say. And then also you always got to get in that one little of why I'm awesome and I would be great for this unit and what I would love about it. Something along those lines. And then again, thank you again.
Perfect.
And that's it.
Send the thank you. So many people talk about sending the thank you, but especially for these in-person jobs, very rarely do the thank you notes actually come through. So it is very much noticed.
Yes.
Perfect. So any Q&As that weren't addressed during this live discussion, we are downloading that box and we will work towards answering them on the Incredible Health social platforms. So keep an eye out over there. And just a quick wrap up that this mock interview was a preview of what Incredible Health does every day for nurses who work with them on their platform. They provide interview support and so much more when you create a profile. And I just wanted to say thank you for being incredible nurses and being on here with us. Thank you, Jacqueline. And any recordings, everything will come out to you after this session. Thank you.